This is our Reservet RV200. It's a neonatal ventilator. It can be used new patient use, neonatal, pediatric, and even an adult also you can use. It's a universal ventilator. So if you keep in a neonatal mode, it starts with 2 ml. This will have invasive as well as non-invasive mode. We can choose whichever you want. Suppose invasive mode, it's a volume control mode is the default. Just start ventilation. Immediately it is connected. Inspiratory to humidifier to the patient to expiratory valve. So this here is the proximal flow sensor for the neonatal. So this is neonatal proximal flow sensor, and this is very simple for operating. This is your setting. This is your patient monitoring. Here you can set the modes, whichever modes you want. Volume control. You want volume control, pressure control, volume pressure SIMB, PRVC SIMB, CPAP pressure support, BiPAP, APRB. These are all are invasive modes. And the setting and monitoring you can see. Now tidal volume 10 ml, so minimum you can go up to 2 ml also it is available. It's starting with the 2 ml. And here in the volume control mode also you can do the PRVC setting. For example, the target tidal volume, suppose you say 15 ml, the target tidal volume. The machine will monitor automatically 4 breaths, consecutive 5 breaths it will measure, and peak pressure, minimum maximum pressure it will control automatically, and it will assure that 15 ml is delivered to the baby. So this is the PRVC setting also in VCV, and peak pressure, PEEP, expiratory tidal volume, inspiratory tidal volume, minute volume, rate, compliance, FiO2, all parameters will be monitored here. Extra monitoring you want, you just touch your values. You can see the plateau pressure, resistance, compliance, auto PEEP, static compliance, dynamic compliance, rapid swallow breathing. These all parameters and carbon dioxide, everything will be monitored in this space. And this is the waveform page, 3 waveforms, and if you want to say loops, you can choose whichever loop you want. You can set flow volume loop or pressure volume loop, whichever loop you want. Here also PV loop, you can change whichever you want. And next is modes, invasive, this is I explained. Now if you want to go non-invasive mode, this is the standby. See, there is a O2 therapy, HFNC, this is exactly a HFNC. You can just start O2 therapy. You can set the flow per baby, flow and oxygen percentage, and humidification. Through humidifier it will go, and here you can connect the nasal cannula. Cannula you can connect. This is your HFNC, and also this will have a standby. If you go with the ventilation modes, there is in non-invasive mode it will have a NCPAP also. NCPAP you can use, and okay. So NCPAP you can start ventilation. So here instead of NCPAP you can see the PEEP and O2 percentage. This is NCPAP. The screen also is changed, and here you can connect instead of the test lung. You remove, here is the nasal cannula. You can fix it. So NCPAP also available, HFNC also available, invasive, non-invasive both are available, and also this machine can be used in the intra-hospital transport. Suppose you want to take baby somewhere, you can put a cylinder here. It has got inbuilt turbine, no need of compressor. And it has got 3 hours battery backup also. So battery backup is there, turbine is a compressor work it will do, and here is the oxygen you can put through low pressure also. You can transport inside the hospital. Also this machine, if you want to transport somewhere longer distance, suppose it is on ventilator mode, it's an NCPAP, it is working. So you take the machine anywhere, the screen lock it, hold the screen, and these 4 screws you unscrew it and lift it and take. Its total weight of the machine is only 9 kg. It can be transported anywhere non-stop. This can work for 1 year also. The turbine is a Switzerland turbine. It will never fail. Non-stop you can use without any external gas source. That's all.